Deirdre Verbo here with Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. Welcome, everybody. I'm happy to be here with you and happy that so many people are getting vaccinated and things are opening up. It's just going to be a beautiful summer. Today, we are very happy to have Andrea Hans-Collins with us. And Andrea Hans-Collins works for Collins Medical Equipment and Accessibility Solutions. It is a family-owned business, and she married into the family. It's been around for 90 years. She is proud to be part of the legacy and a source of knowledge to help families when they need it most by providing high-quality information and resources on healthcare products and services. They have a store and a showroom in Fairfield on 500 Kings Highway, and it features an extensive line of durable medical equipment and examples of accessibility products such as stair lifts and grab bars. If you haven't been in their store, they have so many things, you won't believe it. You'll be like a kid in a candy store if you're looking for things to help your parent. Andrea has over 10 years experience in education, content development, and strategic partnerships. And she's been working for Collins. It's a fairly new adventure for her, but she's excited to learn new things and provide service to people and connect with the healthcare community and beyond. So we're going to welcome, without further ado, Miss Andrea Collins. Hello, Miss Andrea. How are you?
I'm good. I'm very good.
Welcome.
I'm excited to be here.
Yeah, tell us why you joined. Tell us a little bit about Collins, and they've been around 90 years, and why you joined the firm.
So I joined to help them with their marketing campaign, and I'm really excited to be a part of the team. As you said, I did marry into it. So even though I've technically only been officially in the company for 5 months now, so it's November. Yeah, I've been around, and I definitely have known about the company for I think 9 years now. So it's exciting to be actually a part of it. And my favorite part so far, besides learning stuff, because my years of educating, obviously I'm a little bit of a nerd. So learning new stuff is always fun. But also I just really like the fact that we are able to provide help for people. We providing products that are actually needed for people. The fact that we really do have a knowledgeable staff, and even if we don't have it, we want to make sure that people get the best service they can. So we might point you in a direction of a company that we might know that is able to provide what you need, even if we don't have it, even though we do have a lot of stuff.
You do. So Collins Medical Equipment, tell us what kind of equipment. It's durable equipment. It's mainly for people with medical needs. So tell us what kind of things you have, because I'm really impressed by how many things are in the showroom.
So we have two different sides. So we have Collins Medical Equipment, which has been around for a very long time. As you said, we started out 90 years ago as a pharmacy, and have evolved into Collins Medical Equipment for the durable medical equipment. And then we also have another division called Collins Accessibility Solutions. So the medical equipment is the retail side, that the brick and mortar store, and it has lift chairs, walkers, rollators, canes, aids for daily living, a lot of bathroom safety, bedroom safety. Safety is a big deal in our business. We have orthopedic braces, blood pressure monitors, diagnostic products. So a lot of different things right there in the store, as well as things that we can order for you. But we pride ourselves on keeping a good inventory so you can get it quick, because a lot of the stuff you really do need, quickly. And then Collins Accessibility is our kind of our in-home portion. So things that we install in the house. So grab bars, stair lifts, ramps. If you need a remodel of your bathroom, so like if you need to make it a walk-in bathroom, we do that also through accessibility.
You do that? You do that?
Mm-hmm. Yep.
Oh, so you'll remodel a bathroom to have a shower with a lipless walk-in, and you'll do all that?
Yep.
And you install the ramps?
Yep.
Outdoor and like inside if they need a ramp, or how about the stair lifts?
So stair lifts, yes. Yeah, that's actually I'd say stair lifts is one of our big ones that we do, and I actually just videoed one of our installs, and it was really fun to watch it.
Wow.
Because one of the latest technologies where it keeps you level. So as leveling technology, no matter if it's going like kind of up like this, the chair manages to stay level the whole time, and it swivels just right so that you're not swiveling where you might end up falling down the stairs. It'll swivel you like away from the stairs too. So
that is so cool. So let's talk about that. So you've kind of two divisions. One is equipment and the other is equipment that you install in the house.
Right.
Are these covered? Is it like a chairlift, stairlift? I guess it's not a ski resort. Is that covered by Medicare? How does the whole Medicare portion work?
So funny, a lot of people actually do search for chairlift, which I think is funny. But stairlifts are not covered by Medicare, but they are covered by Medicaid. So, and then commercial insurance, it depends on the policy and the plan. But yeah, traditionally stairlifts are not covered at all by Medicare. So for the provider, then we would bill Medicare as for denial, and then Medicaid would end up paying for it. If you have Medicaid, yeah.
Do people with Medicare also have Medicaid?
A lot of times, yes, but not always. Because to get on Medicaid, you have to do the spend down. So there's obviously the income caps and stuff like that. So, yeah.
So, all right. So let's say you're on Medicaid, you would come in, install the lift, pay for the lift, do everything, and it's free to the person at home.
So as long as they have to have a prescription and the doctors to sign off that it's a medical necessity, which is the way it is for anything that's going to be covered by Medicare or Medicaid. Is you're going to need a doctor's prescription and to show that it's medically necessary.
So then you come in now. So let's say the person needs it for 2 or 3 years and they don't need it anymore. What happens to this stairlift?
Well, they own it. So it's really up to them. If they want to sell it or donate it, that's fine. But they own it.
Do you take donations? Like, do you take them back and resell them or reuse them or donate them? Or
we don't at the moment. But I think that that's something that we could look into. And I do know an organization that I don't know if they do stair lifts, but I know for some medical equipment that they will take donations. Yes. Yep.
I had the guy on the show.
With them.
So cool. I had that gentleman on the show who started that, and he's going to go national, even though he just started in Connecticut. It's great. Mm-hmm. So that's your one part of your business. So what kind of things are covered that people have no idea about? I had somebody in my home the other day, and they ordered a wheelchair for their dad, and they didn't go through Medicare. And I said, I'm pretty sure it's covered through Medicare since your dad had a stroke and can't walk. And they were like, oh, okay. They didn't know. So what kind of tell me how it works. You go to your doctor, and if you've had a stroke and can't walk, the doctor may write you a prescription for it. And then people call Collins and you fill it like a.
Yeah. So if the doctor writes them a prescription and has all the paperwork, then I definitely recommend they reach out to us because there's a lot that we do bill Medicare and Medicaid for. But if it's something, say, that is covered, but it just happens to be something we don't bill for, we'll work to try to find someone that does. And we'll try to, we want you to get the best care that you possibly can. And with this many years in the business, we know a lot of the other people that are also in the business. So we'll more than likely be able to point you in the right direction. I don't want to guarantee every time, but we definitely try to do that, though.
So do you find a lot of people don't even know that this stuff is covered?
Yeah. I mean, I know even for myself, I definitely I'm learning. I was like, oh, that's interesting. That's covered and that's not covered and all of that stuff. So there's a lot of people who probably don't know everything that's covered. I would say start with your doctor, but your doctor may not even know everything that's covered either. Then
you were telling me, Andrea, that even compression socks are covered. Things like
for
that.
Certain things, yes. So
if you need them for diabetes or whatever you need them for, if the doctor says you must wear them, right?
Well, for wounds. So which diabetes, you typically might get a wound on your foot. Actually, no I have personal experience with that in my family. And so if you have a wound on your foot and the doctor gives you a prescription for compression stockings that are 20 milliliters or more, which just basically means the squeeze, yes, then that'll be covered by Medicare. But if it's just for, just having it for the benefits of a compression stocking and it's not an actual medical need because of a wound, then that wouldn't be covered.
So tell me some of the really cool things that people don't know about some of the new innovations in like for fall prevention and mobility. And I've seen some cool things like just getting out of bed, like, I don't know what you call them, like standing rails. And
yeah, I mean, honestly, it's a lot of simple stuff that can really help for fall prevention. And that's one of my big things is fall prevention, because it is such a, it's a scary proposition for older people or anyone with mobility issues. I think it's the number one cause of emergency room visits for people over 65, I believe. So that's a big deal for me. But yeah, we have bed rails help so that, if you're getting out of bed in the middle of the night to go to the bathroom, you just have that extra support. We talked a little bit about grab bars, and grab bars are really important for fall prevention, because a lot of people think like the towel rack in their bathroom is enough, but it's absolutely not. It's not made to support human weight. It might just be even attached to like the shower, like glass shower door, which is not made for human weight either. So having that grab bar there that's installed properly, which Collins Accessibility installs things properly.
So let's say somebody buys a grab bar from you. Can they also get it installed and have that covered?
So
covered? No. But you go out and install people's grab bars?
So grab bars aren't covered by Medicare, but I think they might be by Medicaid. You'd want to look that up and research.
So
but
will you put grab bars in a bathtub or a bathroom or things like that?
Oh. So you can you can buy just the grab bars if you want to try to do it yourself. But I recommend having Collins Accessibility Solutions do it, because again, we do it right. Like you have to know that you're putting the grab bars like in a stud as opposed to just the drywall, for instance.
Yes.
And that's what
that happened.
So yeah,
in drywall, and it did not hold up.
Right.
So totally. Right. Do you know, Andrew, that you can now, when you go to hotels, you can I don't know how you ask for a room for seniors, and they'll have grab bars and things in the rooms and in the bathrooms and all. You can ask.
I've seen that a lot of hotels are actually doing accessibility rooms, which which I haven't actually stayed in one, but I recently stayed in a hotel for like the first time since COVID.
Oh, I know. It's been
and when I was looking at rooms to book, I noticed that a lot of hotels are offering these accessibility rooms now, which I think is really great.
That is just telling of how our population is aging and seniors are traveling, and there's so many seniors and so many people that need to be safe.
Yeah.
Especially hotels don't want somebody slipping and falling in the bathroom, right? That's good for everybody, but it's very interesting that they have those. So tell me some of the other really cool new products that you have.
Well, they're not necessarily new, but things that I think really help with fall prevention is, anything in the bathroom, because the bathroom is obviously one of the more dangerous places. So you can get like a safety rail around the toilet. You can get a raised toilet seat, so you're not necessarily getting up and down so far. There's also power lift chairs, which power lift chairs, I think, are kind of overlooked for fall prevention. But when you're able to get out of the chair without pushing yourself, you're not going to have that thrust forward and therefore fall.
The chairs that automatically like lift you up and propel you out. Yeah, we have those. We have those in our dogwood home. Yeah. They start lifting out.
And lift chairs they're so comfortable. And as far as that coverage, again, it's, you have to have the prescription, you have to have the medical necessity for that. But the motor for the lifting action is covered. So not the whole chair. So like the fabric and the wood and all of that stuff.
That's amazing. Okay, the motor part's covered.
A little part. So it depends. Like, that part can be like $200, $250 off of a lift chair.
Wow.
So again, though, it's medical necessity and all that. And if you get a wheelchair covered by Medicare, then you don't qualify for a lift chair because they assume you can walk if you're getting lifted out of a lift chair.
So what I also think is great about the lift chairs is that if you're in a wheelchair, for instance, and you're sitting in a lift chair, and you could back it up, like you can lay the person back so they're not prone to try to stand up. Back it out so your senior can, be comfortable, and you don't have to worry that they're sitting up and they're gonna, fall forward and try to get out because it can go back. So I wouldn't even think of that as a medical piece of equipment.
Absolutely. Like, I mean, for people with arthritis and other joint issues or any muscular sort of issues, lift chairs are fabulous for that. And those are like, if you have a muscular disorder or severe arthritis, those are typically the ones you can get the prescription for. But I'd say if you have any joint issues, a lift chair is great. If you're shaky at all, so a lot of people with walkers and rollators, being able to lift right to where they can just stand right and grab that, it's really helpful. And with the latest technology too. So if you get the nicest lift chair, although honestly, even the more basic ones are super comfortable and helpful. You can have it so your feet are over your heart, so you can do the inversion thing, which helps with swelling and feet issues and things like that too. Yeah.
That's great. And I love that some of them come with, like the ones we have come with a massage chair.
So there are some, yeah.
No, but it's great because especially if you're bedridden or you're wheelchair bound, it's good to have the constant, so you're not getting bed sores and all, to have the movement.
Definitely. I know that we have some in the store that don't necessarily have the massage that we have available in the store right now, but we do have ones that have like a lumbar, so you can really get that position under your back just exactly like how you want. So it'll push in or out however you want, and the head too. So if you're pretty far back, but you want to look up, you don't have to strain your head. Like you can actually just move the head. Yeah, move the head up. So it just depends on kind of the type of chair you have and how many different, they call them zones, that you have. So you can move up to 5 different ways in the some of the chairs.
Wow, that is pretty cool. So now how do people, so if you go to your doctor, do you have to ask for these things, or do doctors say, hey, here's a prescription for a chair that you need to get in and out of? Here's a prescription for, do you have to, is the person typically asking, or is the doctor typically just recommending, and then do they recommend you? How does it all go?
It's definitely both. Some doctors are, of course, are going to be proactive and think about, that, okay, I see your arthritis is getting worse and worse. I think that it's time that you get a lift chair to help you out with that. And then some of it's also going to be people advocating for themselves or their loved ones too, and really asking, do you think this is something that they need? So I always recommend to any patient, research, and if they want to call and ask us questions like, would this be covered if I got a prescription from my doctor, definitely reach out by email or phone, and we're happy to help with that. So yeah, it's definitely both. And then as far as how we get people, it is a lot of referrals from doctors, assisted living, other people in the healthcare industry. And hopefully though, they're also starting to learn more about us in general in the community and what we offer.
So on your website, people can order from anywhere, but in your store, do you deliver just to Fairfield County, New Haven? Do you deliver?
We do deliver. There is a delivery fee, and obviously the farther out that you are, the more the delivery fee is. But we definitely, we do deliver for sure. And accessibility. So if you stair lifts and, all of that stuff that we do for accessibility, we'll do anywhere in the state. So we did a stair lift recently in Gales Ferry, which is
I don't even know what that is.
Yeah, I think it's either right before the casinos or past the casinos, so way over there in the eastern part of the state. We did a stair lift in Cromwell. So we're dotting all over the place with that.
So when somebody puts a stair lift in, when you put a stair lift in, when you don't need it anymore, has it destroyed your walls
or
do you have to patch everything up and take it out? And
I'm not 100% sure about the exact installation. But I know that it depends on the stair lift that you have, whether it attaches to the wall or attaches to the stairs themselves. So the ones that attach to the stairs themselves don't end up causing quite as much damage, which we offer a stair lift that does that. And then as far as if it attaches to the wall, there's going to be some patching that you're going to have to do, of course, but it's not going to be, it's not going to be anything that's more than, any other thing that you're going to drill in.
It would be sturdier if it attached to the stairs, right? Because that's where the weight is.
Mm-hmm.
So that makes sense.
Yeah, that's the one that has the really good leveling and swivel technology.
So. Can people use stair lifts themselves? Like, can they, if you're in a wheelchair, can you get on the stair lift yourself and go down, or do you need an assist?
I think it depends on the person. If you have some mobility, like if you're not, where you if you can get into a bathroom by yourself and that sort of thing, then you should be able to use the stair lift by yourself. But it's really it depends on, kind of what their mobility issue really is.
Yeah, it's kind of, we're in an area where there's so few one-level houses that, yep. Stair lifts are needed, or people have to move downstairs, maybe convert their dining room or their den or something into mm-hmm. And hopefully they have a full bath. I have a gentleman in Greenwich who I love and adore. He's in his mid-80s, lives alone, has no kids. His wife passed 10 years ago. Oh my gosh. He will not put in a stair lift. He does not have a full bathroom downstairs. He goes upstairs to his bedroom. He lives by himself, and he comes down the stairs on his rear end, one stair at a time. Oh my gosh, it's like 87. And I'm like, oh my goodness, you don't have to do that. And you're by yourself. You can, he has money. And I just it's just, oh my gosh,
what it could be. And I mean, and I don't know about if it's for this person in particular, but, there is a little bit of a stigma involved in the actual equipment, and I think it's getting better, but I think that's something that we really need to talk about, is that it's okay to have this equipment. It doesn't mean that you're any less of a person. It doesn't mean that, you're even needy. It just means that, you just need a little bit of help in this one area. I think really working to remove that stigma about things is going to make a big difference, because I think that's partly why people don't even go for the grab bars. They don't even want the grab bars in their bathrooms to show, people are going to see I need grab bars. And
Andrew, I get it. My dad, who had terrible diabetes and neuropathy in his feet, relatives came over, and he's like Mr. New York tour guide, so he was so nervous that relatives were coming over from another country, and he was going to for them, and he couldn't walk in around New York anymore. And I said, Dad, let's order you a wheelchair. He's in his 80s. Let's get a wheelchair and push you around. And he's like, the stigma. And I'm like, I want to be pushed around in a wheelchair in New York City. It's exhausting. I'm like, let me rent it and you can push me around. We actually went on a double-decker bus ride all day, so he didn't have that stigma. So I hear you. But I think if it's in your own home and you're the only one living there, get over the stigma and don't kill yourself falling down the stairs. Oh my gosh, it's it's so helpful to have that, or even a cane, even if you're in your own house, or a walker. Walkers are amazing, right? Walkers are amazing.
Oh yeah, and there's so many different ones. Actually, there's some now that you can stand, so they're tall, so you can put your elbows up here and kind of grab up here and walk like that. So you don't have to lean over, because sometimes, especially if you're tall, I think it's important to get a taller one, because you get hunched over. So it's
in front of you, like a cage, and you're walking.
So basically, there's not a cage looking thing, but it's just these two handles in place for your elbows, and that kind of makes it secure, and then that attaches to the walker that you kind of think of as a walker.
That's a great idea, because when you see people with walkers, they're pretty hunched over half the time. That could just that could keep making them hunched over. I'd imagine that's not going to be helpful for them to straighten up or feel they're walking tall.
Yeah, as somebody that's 5'10", like a regular walker, I would have to hunch over for. So
No, it's not fun.
Mm-mm.
That's pretty cool.
Yeah.
So do you help them like choose what kind of products they need, or are they helped? I know that's probably not your job there, but are they helped in choosing what products they need? Like, can you call up Collins and say, here's the issue with my parent or my loved one, and
Mm-hmm.
what do you think is the best? Because
Oh,
maybe I
yeah.
know about a cane and you know about 20 kinds of walkers, or the kind that you sit down on, the kind that if you're tall. Like, is that
Yeah.
what you guys do?
Yeah, absolutely. So, like you can kind of come in and be like, "Hey, my mother is having this type of surgery, and I'm wanting to make sure that everything is safe when she comes home." I actually did this for my own mother a couple of years ago, um, and just kind of got this certain products that made the bathroom a lot safer for her when she came home from the surgery, and so yeah, absolutely. Come in, kind of give us the story and we can help recommend products that would
So
be
you're
right
like
for you.
senior consultants.
So,
Medical need. You don't even have to be a senior. Medical need consultants.
so, so basically, yeah, like, and again, we're not, we don't know everything, but we definitely luckily we have those 90 years of, uh,
I
of,
think
of knowledge behind us.
that's a pretty good background. I don't know if
Well,
anybody else could say they have 90 years in the durable medical equipment field
yep.
around here. I think that speaks for itself.
Yeah.
How many family members are in the Collins family medical group?
So, geez, I'm trying to think. Okay, so I know that we have one, two, three third generation um, people working there, and then plus one person that was married to a third generation, so it's four. And then we have one, two, fourth generations plus me, so I think seven.
Wow.
I'm trying to think if there's any other ones.
Wow.
So yeah.
That's
Um,
amazing.
So yeah, so it's very family run, and we have a great staff that's not family, and we'd like to consider them like family, for sure. Like we've had some people that have been with us for a very long time, and we're proud of all of our staff, but there is something special about the fact that I think a third of our staff is, if I'm doing the math right, is family. So
That's amazing.
yep.
That's amazing. So at family gatherings, are you always talking business?
More often than I would care for, yeah. No,
I like to talk
yeah.
business. I don't mind, but yeah, I can imagine if you're always talking business, it's, you have to kind of change it up.
Actually, I have to say nowadays I actually enjoy it more, because before it was always like because my husband is in the business, and he would talk at family gatherings about business sometimes, and it was just kind of like, okay, we're trying to have fun here, guys. But now that I'm actually like a part of it, and I know even more what they're talking about, I can get involved in the conversations. I'm a little bit more into it.
That's great. That is super. So if people want to get in touch with you, Andrea, they could call.
Yep.
Is this the best number? 203-576-8642?
Yeah, so that's our general number. So they can get to any division they want to get to. So if they want to talk to the retail store, or if they want to talk to accessibility. We also have another division called insulin pumps, but that's purely referral based business. So
do you do rental equipment too?
We rent some things, and we're looking into renting even more. But it's not the main thing that we do.
And just before you go, talk a little bit about hospital beds and who needs them and how people get them, and if they're covered, if they're not, like about what do they range and.
So hospital beds, really that's. It depends on what the person needs it for. If people really don't feel safe at night, they feel like they're gonna like roll out of bed, or something like that. They might want to upgrade to a hospital bed versus just getting like a bed rail that you can put like under the mattress and make sure it's secure. And hospital beds are covered by Medicare, and sometimes so they're considered a rent to own situation with Medicare. But Medicare policies change all the time. So the products that are rent to own versus outright purchase, and it might be also a case by case basis depending on the client as well.
So, Andrew, when you say rent to own, let's say, my mom needs a hospital bed
Mhm.
and I call, is Medicare paying you a rental fee, your company, or am I paying Medicare a rental fee as the insured?
So Medicare will pay the rental fee for you if it is a rent to own, and typically it's a 10 to 12 month average that rental is until it's owned by you. But yeah, it's covered. That Medicare covers the rental. It's, I think, just more just because it might be a temporary thing. So like if you are just recovering from a surgery, for instance, and you need that extra medical bed to recover from a surgery, it may not be something that you need for, a couple of years or more. And so I think that's the kind of thing. Also, the fact that beds, the structure of the bed can be very well cleaned, and then it can be sold again or rented again. So that's typically the stuff that is the rental end of things, are things that can be very well cleaned, and the products that you get might have already been used as well. Like you aren't guaranteed a new product necessarily, but there is a standard of cleaning and reusing for these products. So
Well, I have to say, like in my Dogwood home where I have 6 seniors, I originally bought all beautiful, adjustable, full size beds that you could, go up and down on. And half the people are in hospital beds.
yeah.
So I've had to take those beds out of the room and put in hospital beds for safety because either they're up in the middle of the night at a full risk, like you say, or people in wheelchairs trying to get up and out. The bed rails don't always work, so they're like slipping out on the bottom of the bed and trying to get out. So for their own safety, families have asked that when we put in the hospital beds, or the families will send the hospital bed. We had one or two, but before I realized they're covered by Medicare, I'm like, well, you guys could order them.
And again, it comes down to prescription, medical need. If they've got that, then then they can get hospital beds covered. So
otherwise they're not very cheap, are they? They're like 1,200 plus, aren't they?
Something like that. Yeah, I haven't looked at the price recently, but they're definitely
all sorts of. And the beautiful part about the hospital bed is it goes up and down. Like the bed that we got just lifts, your back, like you're going to watch TV or get out of bed easily.
Yep.
The hospital beds go down. So if you're in a wheelchair or, if you've shrunken, like we have some 4'9" ladies, if you've shrunken over the years, you kind of need the lower down bed, so, and the rails, and they're great. So,
no, I could definitely, they could be a help for the right, if the right needs that people have, for sure. But like I said, for Medicare, it's all about getting that doctor to, show the medical needs, and and then it would be covered. So
that is amazing. Andrea, thank you so much for coming on to talk to us about your services and your services to install. That's also a huge plus, because I'm sure people might look at like a stair lift and who's going to install. It looks like a big to do.
Yeah.
So it's great that you have this service.
And another thing, just real quick, because I have a lot of like little crusades now that I'm on, is that there are also ways to pay for things that a lot of people don't know about. So I would say just research, because sometimes you can get like grants or no interest loans for different things. So, definitely.
Where would somebody look for a grant for like a stair lift or hospital bed or something? Like, let's say your doctor says this is not medically necessary, but you feel like that would be a safety feature for your parent. Where could you get a grant? Like, are you looking up grants for stair lifts?
So just resources that I would use is I would go to like senior centers, for instance, because a lot of times they're connected to the towns. And some towns actually have grants for things. So, like I know that Fairfield has the Office of Community and Economic Development. I think I'm getting that right. They have a grant for accessibility upgrades, as long as like it improves the value of the home. Cause like basically the point is to make sure that, that the values of homes and that the quality of homes and things are high in Fairfield. So potentially for an upgrade of accessibility, you can get, I believe it's 60%, either a grant or a no interest loan. I don't remember again off the top of my head, but still, no interest loan isn't bad for if you're going to remodel your bathroom.
Are people using them often? How about like the wheelchair ramps? Do you provide the temporary ones that are they metal?
Yep.
Outside?
Yep.
So are they ever covered by Medicare or Medicaid?
I don't believe, no, they're not covered by a Medicaid or Medicare, but there is some expanded Medicare, so the waiver program. So like the brain injury waiver, what's the other one called? I have it in my notes somewhere. Connecticut home care program for elders. So if they're a part of the expanded Medicare with the waiver program, then they can get some things that aren't necessarily covered even by Medicaid, like the regular Medicaid.
And then your other company, the accessibility company, can install that?
Mm-hmm.
Nice.
Yep.
That's great. So you're like a one-stop shop.
So we try to be, yes.
So you can direct and consult and say what's needed, and you can recommend what can be paid by Medicare, Medicaid, and go get a doctor's prescription, and then you can install it. So you can do like everything. So people should call you.
Yeah, that's what really us being a source of knowledge is a big deal for us, because we care about the community and we want the best for the community. So, sure, we definitely, we'd love it if you come down and purchase a lift chair from us. But, we want to be here to provide information so that everybody's taken care of well.
That is so great. I love it. I love it. So even ramps, wheelchair ramps, stair lifts, hospital beds, canes, stockings, you name it.
Even something as simple as a reacher you can get in our store.
What's a reacher? Oh, like to grab items?
Yep. Mm-hmm.
Oh, like from across the table, grab other people's desserts and stuff?
So, yes, I think that's exactly the right thing to use for that.
You like to lift things off the floor?
So, yep.
Like to reach and lift things?
Yep. So lifting the floor off of like high shelves and that sort of thing. So, yep. That's a very simple product, but I kind of use that as like, that's the simplest product we have, all the way up to a bathroom remodel and everything in between.
So when you remodel a bathroom, is that something they could get a grant for?
So there are some programs, yes. And actually, I'm trying to think. I believe it's CIL.org. I know offers some. There's requirements, like there's definitely income maximums and paperwork to fill out and stuff like that. So, but yeah, CIL.org. I know IL stands for independent living, but I forgot what C stands for.
It's really cool. That's so critical. I know so many people, including my own mother-in-law, who never used her bathtub after a while because she couldn't shower because it was in her bathtub.
Yeah.
And we knew she wasn't showering at all because she had used now her bathtub as a storage center because she couldn't shower. So when you open the shower curtain, there was a whole bunch of clothing and stuff in there.
Oh, wow. Wait a second. Yeah.
She couldn't get over the tub. And
right.
I think that's a big sign that a lot of people need help when they can't get over a tub and they're not showering. And these are kind of things that it's good for kids to look for when they go to their parents' house for holidays. And let's look in the bathroom and see if this is safe. Let's look in the bathroom and see if they're showering. Does it look wet using the tub? Is there soap in there? Anything happening in the tub? No? Okay. Maybe they're not showering and they're not.
Yep.
That happens so often. So a bathroom remodel or being able to put I forget what is it called, a stepless shower. I have them in my house. I forgot. Like
the walk-in shower?
Yeah, the walk-in shower. It's called something like stepless, seamless, or lipless shower, whatever.
It might be lipless. I've heard that. I've heard actually all of those different terms. So I'm not sure what the official one is.
They're so wonderful. Like they're so nice. And in fact, there's no stigma in that because I remodel homes and I put those in all high-end homes now.
No, there is a lot in just regular homes. So that's an easy way to have an accessible bathroom. Yeah.
Yeah, because now that's like a cool thing to do.
Yep.
So that is like what people look for. And, it is nice even for people that don't need that extra help. It's a nice feature. So that's great. So,
but I will say, even if like you don't have the money to remodel, get a transfer bench, and don't worry about the stigma of it. Like, just do it. Like, I think safety is so much more important.
Wait, so those are cool. So I've seen those. So those like go over your tub, right?
Yep.
And then you sit outside the tub and somehow you slide over to inside.
So, yeah, so there's different ones. Mostly you kind of lift one leg and then the other leg and then shift over. So, yep.
Like there's so many cool ways. Or it's also good to have a handheld, shower head. So you're not using the one above. And also, like, oftentimes seniors don't want to be wet anymore. Not seniors, but people with Alzheimer's or dementia. Don't really like
sensory.
Yeah, not but so it's the sensory effect. So I'm sure you have all the shower heads and all the special things for that.
Yep.
Excellent. So, all of you out there listening, Collins Medical, you have to give Andrea a call, or the store, or any one of the Collins family members.
Yep. There's plenty of us.
Yeah, there's lots of them. 203-576-8642, 203-576-8642. And I know you said you have a lot of little crusades going on. Do you have another one?
Personal ones, yes.
Talk about another one before we say goodbye?
No. Well, I thought we might plug the one in May, because one of the things also is just, for me, it's wellness, both with seniors and caregivers. I feel like really taking care of yourself and self-care is so important to both seniors and caregivers. And so I'm my final project away from getting my 200-hour yoga instruction certificate and certification. So I'm super excited about that. And I kind of, and I want to specialize on the side for senior and caregiver yoga.
So nice.
Yeah. So I am very excited to have that opportunity on your show later in May.
Yeah, we're so excited for you to come, because I think like chair yoga and all that is so great for seniors, because you still need to move around, even if you're just sitting down, right? You still need to be like moving around and doing.
And there's so many benefits to the simplest moves. Yeah, absolutely. So and then, like I said, I'm a strong believer in just like the taking a moment to just center yourself, come into your body, and just have that moment to not necessarily worry about anything else except for yourself. Like, it sounds selfish, but it's actually not, because when you're able to do that, you're able to provide care and to, just be out in the world better. And so I just think it's very important.
To yourself.
Yep.
Well, you look very fit, so I'll follow you.
Thanks, but you can do yoga no matter what. Like, that's another thing too that I have, is that literally everybody can do yoga.
That's wonderful. Well, we look forward to having you on the show and doing some yoga for the seniors as well. I'm going to do that live in my home when you're on the show that day.
Oh, awesome! Yeah, I'll have a different camera angle and not this thing, because that would make it a little bit difficult. But so I'm very excited.
Thank you so much, Andrea, for coming on. I really appreciate it. Thank you for all that you're doing, and I'm glad you joined the family. And it's going well, and that you're incorporating your other loves for seniors with the whole medical side.
Yes,
so that's
absolutely. Thank you so much for having me. It's been great.
You're welcome. I will see you very soon.
All right.
Bye. Thank you so much, Andrea. She is a blessing. She is amazing. She has brought so much to the community, and the family's 90 years in the field. That's a long time. That's amazing. So if you do want to get in touch with the Andrea or Collins Medical, or have a chairlift put in, I say chairlift, seat lift. Yeah, chairlift. Put in, give the Collins Medical a call at 203-576-8642. And there are so many new products and so many innovations. You're going to love the showroom. You're going to be very impressed. I was very impressed. There are so many things that you could do. Even Andrea didn't mention them, but there are, like, if your parent lifts their shoulders off the bed, alarms go off, or just the little buzzers. And there's so many things that they have that are just for safety. And nowadays with people living so much longer and wanting to live independently, it's very much needed. So thank you so much, Andrea. And until I see you again, I wish everybody well. And I'll say.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe, safe, safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.